So, good evening, everybody. Warm greetings. Hope all of you are doing well. I'm Dr. Chalpati. I'm gastroenterologist. I'm working at Kim's Icon Hospital at Visakhapatnam. So, what a doctor does? So, when you go to a doctor with your symptoms, like whatever we have discussed just now, so what does a doctor do to you? So, he will question you. He will just interview you about your symptoms. He will try to understand what is happening inside and how long you are actually suffering with this, how frequently you are suffering with this. Do you have any risk factors? Do you smoke? Do you drink alcohol? How about your body weight? Do you have any alarming symptoms? Are you vomiting? A lot of things. Whatever we have discussed, all these things will be assessed when you go to a doctor's clinic. So apart from that, if needed, there are certain tests which will be performed. Especially one of the most common tests that is done is endoscopy. So endoscopy is a simple test. It is actually a tube with a camera fitted in the tip, and it is passed through the mouth and inside the esophagus and stomach and small intestine, whatever is actually thoroughly examined. It hardly takes around 4 to 5 minutes with a detailed examination. And once we reach the food pipe, that is esophagus, typically we have to see like what is the problem inside. Are there any risk factors? Most commonly, what we see is how is the lining. As I told, Barrett's esophagus, how is the lining? Is there any ulcer? Is it getting shrinked and getting narrowed? Is the caliber coming down? Is it going to reduce in its volume? Is there any growth? Is there any complication like cancer? Is there any ulcer? Is there any bleed inside? So what is all these things? So all these things will be crystal clear on an endoscopy. Apart from that, most importantly, what we commonly see is, and what patients also commonly are aware of, it is hiatus hernia. So hiatus hernia is something like, in a simple term, if I would like to explain that, there is a small valve-like mechanism between the food pipe, that is the esophagus, and the stomach. So normally, if you see, the valve will be closed like this. So when you eat food, it opens up, allows the food inside into the stomach, and then closes. So when you are not eating, it's in a closed position. But because in GERD, sometimes what happens is it opens up in a permanent way, and it becomes very lax. And if it grows and grows, if the problem goes on, then it can actually get elongated and stomach moves up, and then it can form hiatus hernia. That is called hiatus hernia. So there are various grades of hiatus hernia. It can be detected on endoscopy, and it can be medically managed also. And sometimes I'll need surgery. I'll discuss in the next few minutes. So the other common thing that is done in majority of big centers is manometry and pH studies. So what is manometry? Manometry is a small catheter we pass through the nose, and we actually see how esophagus is moving when you are drinking water. So when you eat food or when you drink water, esophagus moves. It is going to move the food down. It is going to move the liquids down into the stomach. So we are going to assess how is it moving down. So if is there any stagnation, or is the movement pressure enough, or is it more, is it less? So how is the pressure, and how is the pressure at the sphincter, the valve mechanism that I have shown, I've explained to you. So how is the pressure there? All these things will be clearly seen on a manometry, and it also gives a rough estimate how the esophagus is clearing the food and acid once it is exposed. And along with that, at the same time, we are going to do a pH study. So we are going to, if we remember our initial school days of chemistry, we know that acid and alkali, the litmus paper, pH, all these. So there is a special catheter which is called a pH catheter. We are going to put it through the nose, or sometimes we leave it as a small capsule in the esophagus there, and we are going to measure the pH. So acid has a low pH, so that's how we are going to detect on a graphic manner, and we do it for 24 hours, and we are going to see how significant this pH is changing in the esophagus and how severe is the GERD problem. Sometimes what happens is, instead of acid, some people will have reflux because of various other things, especially if there is a gas reflux, if there is bile reflux, if there is alkali reflux, so etc. etc. All these things can be detected at the same time with another special technology called impedance. So all these things are advanced technologies beyond endoscopy. Endoscopy is very commonly done, but if you are having GERD, now it is recommended to have 24-hour pH study and impedance study and manometry, so that it gives a full set of what is happening inside. Sometimes if we find unfortunately a complication like an ulcer, or sometimes a stricture that is narrowing of the caliper, or if in fact if there is a cancer inside, so we are going to do some kind of CT scan or PET scan or a barium study, something like that. So this is how a doctor is going to evaluate. So once we evaluate, now comes the treatment. So how do you treat? So most commonly the treatment is medical, that is with tablets and drugs, and sometimes with some kind of antacid syrups. So there are various kinds of drugs. Majority of people know about all these things. It is taken before breakfast. Antacid tablets like pantoprazole, rabiprazole, esomeprazole, lot of tablets, omeprazole, lot of tablets are there. Ranitidine like tablets are there. So all these tablets are prescribed by your doctor depending on the severity of your problem, which is detected during interview and diagnosed during endoscopy. So all these things will be clearly seen, and then treatment will be planned. So along with that, sometimes we do prescribe immediate relief medications like the syrups and tonics, which can be taken 3 to 4 times a day, and it is ingested, and they will give immediate relief, but it is temporary. Along with that, sometimes we give some prokinetic drugs. Prokinetics means we want to improve the movement of the esophagus and the gut system to clear the acid fast. So sometimes we go for it. So there are various kind of medications you can talk to your doctor regarding that. But the problem is, we should understand that medicine is not all. We have to cut down all the risk factors. Like if you are smoking, stop smoking. If you are having a lot of alcohol, cut down your alcohol, stop it. In fact, if you are taking a lot of painkillers, talk to your doctor. Strike off all the unnecessary medications, because any kind of medication has to go through the esophagus and into the stomach and then into the body. So it can react anytime. So, and it can give you any kind of reaction. So these things have to be discussed with your doctor. Whatever medications you are using, it has to be clearly mentioned to your doctor, and whatever is not necessary, or whatever can trigger GERD has to be discussed with your doctor, and if needed has to be stopped. Very important.